Have you ever felt like you couldn't get enough air into your lungs? Imagine trying to breathe through a narrow straw while your chest feels tight and your airways become swollen. For millions of people around the world, this is what happens during an asthma attack. Asthma is one of the most common respiratory conditions, affecting both children and adults. So, what exactly is asthma? Asthma is a chronic disease of the airways that carry air in and out of the lungs. In people with asthma, these airways are more sensitive than normal and can react strongly to certain triggers. To understand asthma, remember that air normally travels through the bronchi and bronchioles before reaching the lungs. In a healthy person, these airways remain open, allowing air to flow freely. But in someone with asthma, the airways can become inflamed, swollen, and narrowed. During an asthma attack, three things usually happen. First, the lining of the airways becomes inflamed. Second, the muscles surrounding the airways tighten. Third, extra mucus is produced inside the airways. Together, these changes make it much harder for air to move in and out of the lungs. Common symptoms of asthma include wheezing, coughing, shortness of breath, chest tightness, and difficulty breathing. These symptoms can range from mild to severe and may come and go over time. Asthma can be triggered by many factors. Common triggers include dust, pollen, pet dander, smoke, air pollution, cold air, respiratory infections, exercise, and stress. Different people may have different triggers, which is why asthma management often involves identifying and avoiding them. The exact cause of asthma is not fully understood, but it is believed to involve a combination of genetic and environmental factors. People with a family history of asthma or allergies are generally at higher risk. The understanding of asthma has improved significantly as scientists studied inflammation, immune responses, and lung function. This research has helped doctors develop treatments that allow most people with asthma to live normal and active lives. Although asthma cannot usually be cured, it can often be controlled. Treatment commonly includes inhalers, which deliver medication directly into the airways. Some inhalers help relax the muscles around the airways, while others reduce inflammation and prevent attacks from occurring. Today, artificial intelligence is helping improve asthma care. Smart inhalers can record when and how often medication is used, while AI systems analyze this information to identify patterns and predict potential asthma attacks. AI can also study breathing data, air quality information, and medical records to help doctors create more personalized treatment plans. In some cases, smartphone apps connected to AI systems can warn patients when environmental conditions may increase their risk of symptoms. Asthma is a condition that affects the airways and makes breathing more difficult. But with proper management, most people can control their symptoms and live healthy lives. Understanding how asthma works is the first step toward preventing attacks and protecting lung health. But asthma is only one of many lung conditions. In our next video, we'll explore pneumonia explained and discover what happens when the lungs become infected and filled with fluid.